Knee injury types and treatment. Knee injuries are common in both athletes and the general population, and they can vary in severity. The knee is a complex joint with various structures, including ligaments, tendons, cartilage, and bones, making it susceptible to different types of injuries. Here are some common knee injury types and their general treatments. 1. Anterior cruciate ligament, ACL, injury. Description: ACL injuries often occur during sports that involve sudden stops or changes in direction. Symptoms: swelling, instability, and a popping sound at the time of injury. Treatment: surgical reconstruction may be recommended for active individuals, followed by physical therapy to regain strength and stability. 2. Medial collateral ligament, MCL, injury. Description: MCL injuries involve damage to the ligament on the inner side of the knee, often due to a direct blow or a force pushing the knee sideways. Symptoms: swelling, pain on the inner side of the knee, and instability. Treatment: conservative treatment with rest, ice, compression, and physical therapy. Severe cases may require bracing. 3. Meniscus tear. Description: the meniscus is a cartilage that cushions the knee joint. Tears can result from twisting or rotating the knee while bearing weight. Symptoms: swelling, pain, and limited range of motion. Treatment: depending on the type and location of the tear, treatment may involve rest, physical therapy, and, in some cases, arthroscopic surgery to trim or repair the meniscus. 4. Patellar tendinitis. Description: inflammation of the patellar tendon, commonly known as a jumper's knee. Symptoms: pain, tenderness, and swelling around the patellar tendon. Treatment: rest, ice, and anti-inflammatory medications. Physical therapy to strengthen the muscles around the knee may also be recommended. 5. Patellofemoral pain syndrome, PFPS. Description: also known as runner's knee, PFPS involves pain around or behind the kneecap. Symptoms: dull, aching pain, especially during activities like running or climbing stairs. Treatment: physical therapy to address muscle imbalances, stretching, and strengthening exercises. Rest and the use of knee braces may be recommended. 6. Knee bursitis. Description: inflammation of the bursae, fluid-filled sacs, around the knee joint. Symptoms: swelling, warmth, and pain with movement. Treatment: rest, ice, compression, and anti-inflammatory medications. In some cases, bursa aspiration or corticosteroid injections may be considered. 7. Ligament sprains other than ACL/MCL. Description: sprains of other ligaments, such as the posterior cruciate ligament, PCL, or lateral collateral ligament, LCL. Symptoms: swelling, pain, and instability. Treatment: treatment depends on the specific ligament affected. It may involve rest, physical therapy, bracing, or, in severe cases, surgical intervention. 8. Fractures. Description: breaks in the bones around the knee joint. Symptoms: swelling, deformity, pain, and difficulty bearing weight. Treatment: immobilization with a cast or brace, and in some cases, surgical fixation. General tips for knee injury management. Rest: allow the injured knee to rest to promote healing. Ice: apply ice to reduce swelling. Compression: use compression bandages to control swelling. Elevation: elevate the leg to minimize swelling. It's crucial to consult with a healthcare professional for an accurate diagnosis and appropriate treatment based on the specific nature and severity of the knee injury. Physical therapy is often a key component of rehabilitation to restore strength, flexibility, and function. In some cases, surgical intervention may be necessary, especially for severe ligament tears or fractures.